I often hear from patients a sentence that goes like this: I have already had mesotherapy and it didn't help. And every time I ask about what is most important, what exactly was in that syringe? Because it's like saying, I have already taken the pills and they didn't help. Well, what kind of tablets were they? What were the doses? Vitamins in tablets or medications in tablets? It's the same with mesotherapy. It's a method of administering substances. It is a series of small injections into the scalp that deliver something directly where it needs to work. But what is this something? That's a completely different story. Think of it this way. Someone says, I was at a restaurant and I didn't get full. Sounds strange, right? Because a restaurant is a place. What matters is what you ordered. Salad or steak, something nutritious or something you're allergic to. Mesotherapy works in the same way, because what is most important is the content of the syringe. It can be used to provide vitamins. Sounds good, but they are not necessarily effective for hair loss. Because vitamin deficiencies are currently relatively rare, minoxidil can be administered, a drug with documented effects. Platelet-rich plasma, biological stimulation of living follicles, or just regular saline solution, which won't really do anything. The effect will be completely different in each case. Therefore, before we say whether mesotherapy can help you, I need to know exactly what you have been receiving. What type of hair loss do you have, and is there still anything to stimulate? Mesotherapy is a tool, like a syringe. The syringe itself does not heal. It heals what is inside. If you have had mesotherapy and it didn't help, don't dismiss the method. Ask about one thing. What was in that syringe and in what dosage? Thank you for participating in the lesson, and see you soon in the next ones.